Hi everybody, good afternoon, see you again. For those that were connected before, so we had some technical issue, I think. Our Ronke was actually online, but she couldn't enter in the live. So I'll be waiting her to connect again and see if we can start the live. So Ronke, I can see your line. Trying to send me a request to participate and see if it can work. So meanwhile, we're waiting for Ronke. Okay, let's start now. Okay.
We made it.
Okay, finally.
Okay.
Good afternoon.
Hello there. Okay?
Yeah, I can see. I can hear you. Can you hear
Cool.
me?
Yeah.
Perfect. Well, welcome to our community.
Thank you. Thank you for having me.
Thank you so much for accepting our invitation. I was explaining before, the Feminist Health blog is a blog talking about health issues concerning women in all its factors. And I think was March, April, we did already an article with, we actually wrote an article with Christiana Ilinsami. She's UK Nigerian psychotherapist too. And we've spoken more about how the first pandemic crisis affected people mentally. And how actually even affected women or even Black women last year. So what we thought out the Feminist Health blog, it was to talk about if there have been some changes during the second wave. Consider the fact, I mean, almost a year has passed, and the COVID-19, it seems something like we used to, but at the same time, we still have many things to discover yet. And I met Ronke, I think, one meeting with friends, with mutual friends. And when I discovered that she's a therapist, I was amazed because I don't know if you have noticed in Italy, Black representation is not something very popular, and to see such professionals in such places, and it's actually something that I'm always happy to see. So when I thought about this episode, the first person that came in mind was Ronke, and that's how I approached to her, and I'm so happy that she accepted our invitation. Well, let's start. Can you first of all, a little bit for the people that doesn't know you, can you introduce yourself? Who you are, where do you live, and what do you do?
Okay. So, hi everyone. Thank you for having me again. My name is Ronke Oluwadare. I am Italian, born and raised here from Nigerian parents. I live in Milan currently. What I do is that I'm a psychologist, and I am an organizational psychologist, and I am a psychotherapist too. This means that I work both with companies and with individuals.
Mm-hmm.
I don't know if you hear it too, Ife, the sound. I think it's me.
Yeah, you have like something sound, but I don't know.
Just wait a second.
Mm-hmm.
Let's try it.
Okay.
Can you hear me better?
Talk.
What about now?
Okay, yeah, perfect.
Okay. So, as I was saying, I work both with companies and individuals.
Mm-hmm.
I support, still hear this annoying sound, sorry. I support companies with their HR processes.
Okay.
Like, I don't know, recruiting, training, development. And I'm a psychotherapist, so I work with individuals with the challenge that they face and try to support them whether they cannot face it alone. So this is what I do.
Okay, perfect. Do you work with companies mostly in Italy or even international companies, even with the people? Like, do you do even now online therapy with the people only in Italy or even abroad?
No, both with companies and individuals. I work with foreigners company, and by foreigner I meant non-Italian.
Okay.
And same for individuals too. So I do also therapy with patients that are not located in Italy, and they are not Italian either. And I do, of course, that via Skype online.
Yeah. Okay. That's actually, it's even like for anyone that would like to to ask for any help or something. So for you don't have to be in Italy or be in Milan. So as I said, for me, I was very happy to see a Black person, especially a Black woman, doing this type of work because as I was saying in the video before, mental health always being kind of taboo, especially in the Black community. But I'm not very aware about how is this field had to be as a woman and a Black woman. How was the experience during your education and career being a Black woman?
I mean, I would say that being a woman in my field is not that difficult, honestly, because, I mean, if you think out of psychologist in Italy, you for sure think I'm a woman, usually. So it was okay as a woman. It was comfortable and safe. And I don't think I faced any challenges, even though, I mean, it's a women world, but it's ruled by men, mostly because, I don't know, if I think about the schools that you need to go to become a therapist, usually is run by a man. Even though psychologists in Italy are mostly women. So, I mean, as a woman, it was okay. I'm not sure how to answer how it was as a Black woman, because I'm usually the only Black person in a room or even in the building, but this is how Italy currently works. So I don't think that my Blackness was actually a thing. So I'm kind of sure that if you ask anyone that was in the field with me, or even if you ask to my colleague, I'm not quite sure if a Blackness is a thing.
Okay. Well, actually,
for them.
That's actually is reassuring in a way, because it shouldn't be a thing. On the other hand, hopefully, like, the good experience that you had during education and work was from mutual respect between colleagues and people. I had the same experience, like during my education and during university and everything. Mostly always being the only Black girl, the only Black person in the building, and yeah, exactly. Even in the hospital, we were very, very, very few Black person, and even I think like most of my colleagues and my university mates didn't see me as a Black person. I'm more like just Ifoma as a person, and that can be okay, because I mean it's okay. It's true. I'm not identifying myself only from my skin color, but definitely sometimes maybe it would have even be good like to let them know that I'm Black, and definitely something like involves other things, culturally, socially, but definitely is an experience that we have that we experience many people of our generation that have heard.
Yeah, definitely.
Yeah. Instead, concerning of your, so you say that you even do individual therapy to people, and do you have did you see or did you notice any relevant differences between what women and men come to you, what kind of help they ask you, compared the two genders?
Yeah. So based on my experience, I would say that men look for psychological support way less than women.
Okay.
So if I think about the percentage of my patients, I would say that, I don't know, 85% of them are women and just 15 are
What's
men.
wrong with us?
And
What's wrong with us?
and this works both. I mean, because I work with teenagers too, but even if I think about my teenager patients, most of them are girls.
Okay.
So I would say that the first point to point out is men seek less psychological support than women. On the other end, this will mean that when men or boys are finally looking for the psychological support, usually they are in a really bad place, right?
Okay.
Because they probably tried all and probably they are struggling since quite a while, but they reach me only when it's really nothing else they can do, right? And this means that symptoms-wise, it's even more difficult to work through them because they're already stuck in their habits.
Yeah.
So this is based, of course, on my experience. And these are the main differences, I would say. And adding this to that, I don't think that then in the relationship with me, something changed.
Okay.
I mean, based on women and men, but I would have to say that for sure, some men struggle to be in a therapeutical relationship with me because I'm a woman. And like, especially when we talk about sexuality, for instance, for them, it's kind of, I don't know, either triggering or a bit of a struggle to talk to me regarding those topics. And I usually reassure them. I mean, I usually tell them I feel there is a struggle. Let's talk about the struggle first, and then we see if we can work together through this topic, because sometimes they just don't feel like.
Yeah, sure. Do you think that the fact that you have like 80% of your individual patients are women is because like mental health is still very considered in men kind of taboo, so they feel more ashamed to ask for help compared to women?
Absolutely. I don't think that they feel legitimate to actually ask for help. This is, I usually call it the other hand of the toxic masculinity culture we are into. So toxic masculinity is harmful for women because there is a lot of sex expectations, right? But it's also harmful for men because they put them in a position of have to be like this kind of superhero that they never struggle, they never cry, they never need anyone. And this leads to the fact that they struggle to ask help, psychological help, of course. And you can see that because if you look at the percentage of, for instance, suicides, men rate are higher than women.
Yeah.
And this is a terrible sign, I would say. So if you think about it, this is kind of painful, honestly. So for sure, this is the other side of the toxic masculinity.
Definitely, yeah. I've spoken a lot with even with male friends about because they always say like women are emotional. Oh, you're always emotional. You always like complain, crying, and everything. And I say like, well, you people are emotional too, but you don't want to show it because of some cultural and social like opinion about how men should be behave, how men should be always be strong, always be self-confident and everything, and consider like, as you say, crying or showing emotions a sign of weakness. And when you say the percentage of your patient that is not only you are actually assuming, say that they have most, like as you say, women most come ask for help to a therapist compared to men, and as you say, at the same time, the cases of suicide are higher in men. It directly let me think about that. There must be something that is missing, and the thing is missing is like men don't feel comfortable to ask for help, like mentally and psychologically help. And
yeah, it's like a stigma, I would say.
yeah. And based on in fact, and you mentioned of the fact that maybe even men are sometimes embarrassed or don't feel comfortable to talk some topic. So have you ever been in a situation where maybe you're being chosen as a therapist because you're a woman, or because you're a Black woman, or at the same time you're being rejected because you're a woman, maybe a man wants to be followed by a man, or wants to be followed by a white person, or because somebody wants I don't know, say like somebody of Muslim religion. Have you ever been in this kind of situation?
So I don't know whether I was rejected for any of my demographic characteristics, because usually patients, when they reject you, they just disappear. So we will never know. And I also work in facilities where not always you can choose the therapist that is going to follow your case. So they do a first meeting with someone else, and then they just get me, right?
Okay.
So there is nothing more they can do about it. I would say that instead, all my Black patients chose me because I'm Black, definitely. This for no doubt. And the reason why is that is because for many of them, having to explain in therapy the struggles of carrying a Black body in a white world is too much. And they are looking for feeling comfortable in therapy since minute one. And this is what they look for when they call out for me. So I would say that I don't know for the other cases. So I don't know if I've been chosen because I was a woman, neither for men or women. And I don't know whether if I was rejected for any of these characteristics. I know for sure that all my Black patients chose me because I am Black. I'm a Black person.
Yeah. I mean, I can imagine, like, if I have to think about, it's kind of a choices that those factors actually can influence the choices of the person that you want to be followed. Even in the medical field, I could actually see the differences of approaching when a Black patient sees me. Like the smile, like the become,
of course,
and that's why I wanted to ask you. Obviously, it's not like it's understandable that you don't know if you've been choosing for the other type of characteristic like gender or religion or whatever. But it came in my mind, this question, because I remember a friend that had to choose a therapist, and I think it was an online platform, so you could choose like a therapist based on the gender, ethnicity, and all the qualification that they had, and all the questions that we're asking each other, like, would you prefer Black? Would you prefer a man? Would you prefer a woman? And definitely you don't know, because you don't know. Maybe it's like, oh, maybe it's a man, but maybe I don't know, maybe the woman is too emotional, maybe the man won't understand me. And in this platform was even like sexual preferences, so that you know that if it's a gay therapist or a straight therapist or no binary. And even that one was actually like, you don't know, maybe if you want somebody like that, or you don't want to be even too much judgmental, like you want to be more objectively, like, I want to be followed because it has the kind of qualification and not because it's this or that. So, but definitely there's a possibility. So like, people, like, if you want to know, like, you even can consider this factor if it can actually help you to be me more comfortable to talk with the other person, obviously.
Yeah, I honestly agree on this point. I don't think that the success of the therapy is based on whether I am a Black person as my Black patient. That's not for sure. I think that it's based on how the patients feel, right? So how comfortable they are to talk with a woman rather than with a man, rather with a non-binary person and whatsoever, right? So it's about them. It's about how they feel, because it doesn't mean that that will be a successful therapy. This is what I usually say and tell them, because therapy is mostly a relationship, as any other relationship. It really depends on the person. I'm not just a Black person, right? So this might give them the chance to feel more relaxed around me, but doesn't mean I am the right therapist for them. So I usually challenge them to ask themselves whether they feel right with me, because it doesn't mean they do. And I don't want them to take that for granted just because I am the only Black therapist around, right?
Yeah. Actually, thank you. Actually, this is a very good point to reflect when we have the opportunity to choose a therapist. Actually, thank you so much for sharing with us. What I was saying even previously, that we already did a content about mental health, reflecting on what happened in the first crisis, how people actually change, like how the pandemic changed their lives, like working from home, not be able to go in house, seeing people, and definitely this have affected a lot mentally people in a good and a bad way. And I've noticed some changes with this second lockdown in Italy, but even talking with my friends abroad. And for example, I've heard many people say that they are more bored now, because I know before everything was new. I say, yes, now I'm going to be take care of myself, just sleep more hours and everything. And now they are frustrating to stay at home, even though maybe people are still continuing working, but they're frustrating to be stay at home, and they're not motivated as before. Did you notice this even in your patients? And do you think that now this second wave can really seriously put at risk our mental health, considering like this how people now are reacting in this second phase?
I totally agree with the feedback that your friends gave you. This second wave, this second emergency is completely different from the first. I think at first we thought it was a new thing. So what happened is that we adapt, because human beings have been designed to adapt, right? So we actually did, and we use our internal resources to face all the new challenges of being home. I mean, I don't know elsewhere, but in Italy we saw a lot of people baking, for instance.
Oh wow!
And
the pizza and the pasta.
Writing books and stuff. So we made it out, right? So, and we thought it was a short-term situation. And then the second time, especially after the summer, when we kind of smell our old and previous life, I think in September it was kind of a challenge to go back to being closed up. Because we definitely finish our internal resources, and we don't know where to get them in order to survive to this emergency that probably will last so many months more. And I think that I saw this difference also in my patients, because I took a different decisions, for instance, comparing to the first time. So the first time I stopped seeing my patients in presence. So I told them, okay, there is an emergency. We are going to transition online. And I actually paused all the therapy of people that weren't able to meet me online because maybe they don't feel comfortable to meet me at home, right? Because not everyone is living alone.
Yeah.
In the second emergency, I didn't decide to stop that because I felt that people needed to feel connected to me as well.
Okay.
So I decided to just keep working because I can. So, and it was actually a decision based on the fact that I noticed that we actually finished the resources to facing this kind of the pandemic and all the restrictions that goes along with the pandemic. And it's hard, it's complicated to actually find them out because the only two things that we are allowed to do right now is work and buying things, right? And it doesn't make any sense because neither of these two actions is actually are actually able to give us back if we don't have all the other stuff. So our friends, our family, our hobbies and stuff like that. So from my perspective, I got the feeling that the government, our government, but also the other, because they're all taking the same decision, are underestimating the priority of mental health in people, because they are taking decision like the human being going to work is not the same human being that is being neglected to see their families, their friends, and I don't know, go to the gym, for instance. It's the same person, but we are expecting from us to do the same things like nothing happened. So to work now 9 to 5 and to be productive and to buy stuff like we are machines and not, human beings. And it doesn't really make sense from my perspective.
Yeah. In fact, now that you mentioned the government, and I remember in the first pandemic, there were finally a lot of attention on mental health, and there were few let me say supports coming from professionals as you, giving help for those that they needed, like somebody that you need maybe to talk and everything. And I think, as you said, we're not the same person as last year, and I think especially even from what I heard from people, when it's going to be end, I will never. It's going to be finished anyhow. Kind of sensation, feelings of hopeless, not only frustration, but there's nothing. At least it's true. There's nothing at the moment that we can do apart from following the security and safety guidelines, social distancing, wearing masks and everything. Now we have the vaccination, but as we said, is a novel vaccination. And before we can get kind of an immunization, it's going to be a month. It's going to be passed, and we have to see even how many people they're going to vaccinate it. So it's not something that can assure that we're going to back to life like this. What do you think what can you think that we can do? What can be the strategies that we can do, or what do you think the government or other institution can do to help people in general to trying to resist this crisis until the end, that we don't know, but definitely it's going to finish. But I totally understand and believe people when they say that it's so hard to stay at home, to not see their parents, their relatives, and so what do you suggest can be some strategies to do?
So what we are currently facing, I think, in this second emergency is that, as I said, we finished the resources, and what I'm actually seeing, especially in my patients, is they feel
The main symptoms are apathy, loss of motivation. I mean, loss of, they're not driven anymore. They have sleeping issues, and they don't know how to recover from that because they already try it all from their perspective. Mm-hmm. And what we are underestimating is the power, and on this other hand, the lack of touch that we are facing right now.
Yeah.
So we already tried to resist, but a year without being touched and without touch other people is too much, because I don't think we never realized it before this emergency, how many times we actually physically touch someone, and this do not give us the information on how meaningful it is for us to be touched and to touch. Even just, I don't know, a quick squeeze with your colleague, right? Mm-hmm. So what I would love for the government to start thinking about it, considering, as you said, this is going to last quite a while still, mm-hmm. is to start thinking on a solution for people to actually being able to be safe and connected again, because this is the only way we can actually figure it out. Mm-hmm. Because not everyone especially lives with someone, so they need the feeling to get connected. And I don't think that, Netflix series of people hugging and, and heavy blanket, or, petting the dog of the neighbor will last. This works, but I don't think the benefits of these things will last long enough. Yeah. So we definitely need to find a safe way to get connected again, because there is no other way we can actually properly live in a healthy way without that, without the other. We are social animals, and there is nothing we can do about it.
Yeah, I totally agree with you, and even one of our friend, call it David, that is somebody that doesn't like at all contact, physical contact. He actually realized that some days that he had the feeling that he needs to hug somebody, because he has not been hugged anybody for a long time. That when somebody he hugged somebody and the other person is like, wow. Because during this pandemic, because of the fear of touching and everything, you are restrained. Now even when we see people hugging and touching, we're like, what is happening? So even
what's going on?
Exactly. And actually it came in my mind something that you might be happy. So you say that the government should do something to keep us safe, but at the same time connected. So mm-hmm. we have so the Ministry of Health now have said that hospitals can actually allow relatives to go and see COVID patients, and each hospitals have to kind of develop a procedure to make this possible, because obviously it's not something easy, because you allow somebody that probably is COVID negative, or you have to do a test before to enter and go to a COVID ward where there's a very high risk of infection. But because, as you said, the press and the stress of the general population to not be allowed to see their relatives in the hospital for a long time, and not see even before dying, because for people with COVID, there was totally banned the word. You cannot see, you just see them inside. You just say bye-bye without even see them. It actually was something very hurtful, and I totally understand. And so There are actually each hospitals that are developing a procedure in collaboration with psychologists, because for what I've heard, because I didn't read the ministry communication, psychologists should consider each situation, and they should give support to the relatives before and after seeing the relatives in the ward. What do you think as this strategy? Do you think is a good move, or is a risky move? What psychologists can be really helpful in that situation?
Honestly, I think that it was, of course, is risky, right? Because we already noticed it's been a year, and the way to survive is to stay at home, right? to not have contact with anyone. Mm-hmm. Simple as that. We noticed. But I do think this is a great idea, mm-hmm. because being connected and also touch people is actually a protection factor. Right? Okay. So I'm gonna get better sooner and easier if I am not alone. Mm-hmm. And for the people who are not in the hospital, they're gonna face this trauma easier and faster if are actually in contact with their loved ones. What we did in the first emergency was a mess. I mean, mentally health-wise, it was a mess. To figure it out a loss without saying goodbye and without knowing what happened to them is super complicated.
Yeah.
We have no idea what we have done. And we will figure it out in a year from now, because the loss process is long. It lasts 2 years. By manual, I mean psychological.
Wow.
It lasts at least 2 years. So in a year, we will figure it out, which are the effects of our decision of making these people not seeing anyone and losing people without saying goodbye. We do not know yet what we've done for the mental health of our country, honestly. So I do think it's a great idea. And we do need to start doing that also for the people who are not in the hospital.
Yeah, totally. I mean, it's a different point of view. Guys, a medical doctor is speaking and a psychologist is speaking. Like when this procedure came out, we are totally like really scared, because obviously we're always scared for anyone that goes to work there, even with all the mask and everything and stuff. And thinking about a relative to see somebody that you even get emotional, and maybe you touching more than you're supposed to touch and everything, it's really, really scary. But as you say, we got to a point, like after a while, we got to a point that even us was actually very heavy, very difficult to tell the relatives you cannot see your because before it was even like grandparents, like maybe people of more than 80 years old, 90 years old and everything. But when it has become to like father and mother and younger people, that was actually really, really heavy. And I think that government have heard and felt the situation, and that's why I think they came out with this new procedure to do, and very soon it's going to be in the they should be like in a hospital, and everyone has to decide in which cases you can allow to visit the relative. Going back a little bit of women's situation, let's say that the numbers, statistical say that the cases of depression and suicide has risen, as we say, because of the situation, and women has impacted even a lot women, especially in depression situation, and what it probably be obvious, but what you suggest, what can women do to like even try face this this situation of depression, especially, and suicide attempts?
So I want us to take a step back.
Mm-hmm.
So the depression and suicidal thoughts or suicidal acts actually are not always connected.
Okay.
So the first thing I would like to say is just do not get scared. Okay, even if you get diagnosed with depression. So there are two phenomena that sometimes they're linked, sometimes they're not.
Mm-hmm.
And the step back is even negative emotion should not scare you off, because negative emotions do not lead to depression, that do not lead to suicide.
Mm-hmm. Okay.
What I think people should start, people and women especially should start thinking about it is when they got the feeling to be detached from their body.
Okay.
So when they got, at the end of the day, they got the feeling that they didn't felt anything emotion-wise, they got zero sensation of their body, they are really struggling to stay on a precise thought, so their head just go up and down on different thoughts, I would say this could be an alarm. So at this point, get scared and seek for help. First thing, seek for a professional help, that it doesn't lead to a medicine by force.
Mm-hmm.
Because it's not me, studies say that also when the depression gets diagnosed, it needs to be, the therapy needs to go along the psychotherapy and the pharmaceutical therapy, right?
Okay.
This needs to go along because it's a pattern.
Mm-hmm.
So maybe you can fix some situation, the urgency with the medicine, but you still need psychotherapy to actually understand what is your pattern, what is triggering it, and how to face it in your own system, right?
Mm-hmm.
So my first suggestion is this: get to know yourself to figure it out whether you're in a critique situation, and if you are, really, like if it's super heavy to wake up, it's difficult to get out of bed, if at the end of the day, after a long day of work, you got the feeling that you spend the entire day not in connection with your emotion, with your sensation, and with your body, then seek for help. Then get a professional that gives you a feedback on how you're feeling. If you're not inside of this situation, doesn't mean that you're not struggling.
Mm-hmm.
But it means that maybe you need to find a new routine.
Okay. Okay. So yeah, definitely knowing ourselves, that is actually like something we take so much for granted, and I think even the COVID-19 pandemic has actually helped people to understand that we are not spend and invest time for ourselves, to understand ourselves, our need. How do we feel? How do we feel like in the work environment, in family environment, in relationship environment? This is actually very, very good point. Thank you for sharing it. So we have the last question that is actually, we can it's kind of sum up a little bit of what we would like to send the message to all the women out there, and especially because when we talk about women, we're talking about mother, sisters, wife, professionals, and all these figures. Sometimes I think I even experience personally, because not personal me, but personal, like my colleagues. She's a mother, she works, and she's even like a sister, and the pandemic, and especially the second wave, probably has been very challenging for her, because For example, for the work, she couldn't take their children to school, and maybe for work she couldn't stay enough with the husband, and the husband, if he wants to go out, she wants to stay home because she's tired, and yeah. I have literally colleagues that with the partners, they actually complain a lot to the fact that I mean, they work from home, so they can actually go outside by themselves, but they wanted to do with the partner. So they're stressing out that they would like to go out with the partner, and the partner that are my colleagues, because we are all women. They say, I'm tired. Like, when I am home, I want to stay home, and this actually can. I'm saying it with a smile, but I understand that this can be actually even challenging for the relationship, because you're not in the same level. So what advice can you tell to all these women that are trying to find a balance in all their on their role in everyday life?
So I'm gonna say something crazy right now, but honestly, I do think that as a women, we should be thankful somehow to the pandemic. So women out there, don't kill me, just give me a second. But I think that the pandemic just finally get us to realize that this superwoman pattern that we've been into doesn't make any sense. So with this, I should have it all state of mind. Mm-hmm. Finally do not make sense. It is impossible, right? Because we are not superhero, as I said before. Mm-hmm. We are human. Mm-hmm. So thanks pandemic to let us realize we cannot be superwoman. Said so, we need to start realize that every position we take as a daughter, as, a mother, as a partner, as a worker, and whatsoever, as a professional, is that it takes a lot of emotional work to do all these things all at the same time. Yeah. And so the first advice is be kind to yourself, because you're doing, 10 work at the time. So be kind to yourself. It is impossible to do all these things all together, and as we've been taught to say, because this superwoman thing is tricky, and I don't think that before the pandemic we realized it was harmful for us. It's because you get rewarded. If you think about it, in our current society, you get crazy rewarded if you're a professional, a mother, a present partner, a great friend, So it gets rewarded. And it's crazy because you should not get rewarded to kill yourself while you're living, right?
Yeah.
So really, first thing, be kind to yourself. Second advice is do a priority list. And this is something I'm telling this to myself every day, and when I got the chance, I tell it to my female friends, and I tell them to my female patients, is that indeed you should desire all, mm-hmm. right? But you cannot have it all perfectly at the same time. So you need to list everything that you want, and to get your energy through one goal at a time in order to get all these goals satisfied, but in a healthy way, both physical and mentally. Because I got the feeling that not always we are connected to our body in order to figure it out, that we are harming ourselves also physically wise. Because if you're struggling with the sleeping, right, and if your stomach hurts, and if your back hurts and your neck hurts, that is your body telling you, woman, I am about to abandon you, right? So just, be kind, make a list, And most of all, do at least a 15-minute self-love kind of a thing a day, right? A moment of the day, whether you are your priority. And I mean, you can do it all. I mean, lately meditating is on the rise, but it works with everything. Just dance, read, I don't know, get a good laugh, call a friend, prepare a cake for your neighbor, whatsoever. I mean, really, what works for you? Because we are all different, and I'm not a fan of advices and suggestions because I don't know everyone, and we are different indeed.
Yeah,
but the third thing I would say, just give yourself 15 minutes a day, because we are to be health needs to be one of our goals.
That is actually true. And actually, it's a good suggest about the list of priorities. Because, as I say, maybe because of, maybe it's a coincidence of the people, but I meet a lot of perfectionist women. So they want to be perfect in this, perfect in that, perfect in this. And they give really everything this in everything that. But as you say, there's a point where one thing that is going to be is not going to be right. And in fact, I have a friend, for example, that she's going to change work, because I believe, but because she didn't tell me, but I believe that the work is affecting her relationship with the partner. So, and obviously, so you think that you're doing everything okay and everything, but at one point there would be something that is not going well as before, and you have to take priorities. And so she took priority, her relationship with the partner, compared to maybe career at work or a type of work. Like, she's going to continue in the same field, but she asked to move in another field that has less work. You know, you don't have on call, that they don't call you in the night, in the weekends, and everything. So another type of life. And even though that she knows that she's going to be bored, because already said you're going to be bored, but yeah, she's going to be bored, definitely. But
maybe not. Maybe not, because I also got the feeling that sometimes we not always understand and knows who we are doing all these things for. Is it for me? Like, I ask myself at least once a week, who am I doing this for? Because if Ronke is not the answer, then I'm just going to drop it. So if your job is driving you crazy, ask yourself, who I'm doing this for? Because often the answer is not you.
Yeah.
So just drop it. And this is valid for everything, the relationship, the hobby, the friends as well.
Friends as well. Exactly.
I think that we should start asking ourselves more questions. Without questions, it's impossible to know yourself. But it's the same pattern that you use when you get in a relationship with someone else, right?
Mm-hmm.
So you want to know someone new, you ask questions, you're curious. I don't think we have the same curiosity towards ourselves. Just ask yourself a question. Do I still like this? Yes or no? Because something that I loved yesterday, it doesn't mean that I still need to love it forever. So yes, 3 years ago, 4 years ago, myself was crazy in love with being called in the night and being career driven, right? But I'm not the same person anymore. I need to ask myself whether this is talking about me now. Because if it's not, just drop it.
That's right. Lawrence wrote Pop Lock and drop it. Pop Lock and drop it. Exactly.
Thank you, Lawrence.
Exactly. Like, really, yes, I totally agree. I totally agree, because I think even about myself. Don't, like, asking ourselves, like, asking more of ourselves if it's really worth it. It's really what we want to do. Are we okay? Are we doing fine? And basing on the answer, decide what is going to be the next move. So really, really, really thank you, Ronke, for your message.
Thank you, guys.
And
girls mostly, I would say.
No, thank you so much. Thank you everybody for joining us, Ronke and I. So if as always, we're going to save the live in our Instagram page.
Okay.
So you can if somebody has just came late or could have followed us before, you can check all my questions and the amazing answer of Ronke about the second wave and mental health and other things that actually came out, if you want to be curious. And Ronke has a page. She has a personal page, but I think like if anybody wants to be followed by her for any reason, you can shout out to her in DM, and maybe her personal page has information how to get contact with her and everything. So thank you again, dear, and hopefully we'll see you soon.
Fingers crossed.
We're yellow.
Yes, we are.
Yeah, guys.
Black and yellow, black and yellow, black and yellow, black and yellow. You know what it is.
So hopefully we're going to see you soon and drink a glass of wine together. And for the others, have a nice weekend, have a nice final Sunday, and have a great start of the week tomorrow.
Yes, let's do this.
Yes.
Bye, everyone.
Thank you. Bye.